Madam Speaker, I rise to support the report of the Health Committee on the petition by cancer patients. Madam Speaker, the situation, and I'm a member of the Health Committee, Madam Speaker, the situation that cancer patients in this country are going through, before we even begin to speak about those whose cancer status has not been determined, they have not been screened, they have not been diagnosed, the cancer patients, their families and their relatives are being confined to a life of poverty by the treatment protocol that is existing. Madam Speaker, diagnosing cancer itself comes at a cost, and unfortunately, the entire diagnosis process is an outpatient process. Yet we have been telling our patients, register for SHA under the Primary Healthcare Fund, that you are entitled to ultrasounds, you are entitled to x-rays, you are entitled to CT scans, you are entitled to MRIs, yet none, without exception, none of the primary health care facilities have the capacity to diagnose cancer, not even the most elementary diagnostic tool of cancer markers in blood. And therefore, cancer patients have to remain in the queue as cancer is continuing to advance and eat into their bodies until they can find money to pay for CT scans that are going for 6,800 shillings in Nyeri, and MRIs, some of which are not available in this country. Madam Speaker, my own mother needed an endocrino PET scan. We had to fly her out of this country. Despite the fact that that treatment and diagnostic procedure was not available in this country, despite her being fully paid up in terms of NHIF and SHA, she never got the support. How many families are in this position that I am in, that we are in this country, that they can afford to fly their relatives, their children, their parents out of this country for a PET scan? Madam Speaker, the treatment package offered by SHA cannot even cover the entire package for chemotherapy, for breast cancer, for cervical cancer, for prostate cancer, for gastrointestinal cancer. And when that treatment has to be combined with radiotherapy, parents, patients, their relatives, their communities have no choice than to fundraise. And we have pronouncements by C.S. Duale that we have increased the cancer package from 450,000 to 800,000. Today, I have to call to order the Ministry of Health. Madam Speaker, the 150,000 promised to cancer patients is supposed to come from the Emergency, Chronic, and Critical Illnesses Fund. Yet that component of the fund has not been activated. Why are we lying to Kenyans? Why should a CS lie to Kenyans, Madam Speaker? Madam Speaker, add me one more minute. Madam Speaker.
Your time will be up soon. Kindly wind up.
Madam Speaker, the petition by cancer patients, the report of this committee should be wholeheartedly adopted by this House, but more importantly, the recommendations must be implemented as a matter of urgency. And I call upon the implementation committee of this house to please take up this issue. Kenyans are suffering and we can no longer keep quiet. We can no longer.
Your time is up. Thank you. Your time is up. Honorable members, you know we have an adjournment motion at exactly 5:30. That is why we shall not be adding any time on any speaker. Honorable Jessica Mbalu.
Thank you, Madam Speaker. I rise to support the report on public petition number 021 of 2025 regarding access to healthcare by cancer patients in the country by the Department of Committee of Health. Madam Speaker, this petition was filed in this House, the National Assembly of the Parliament, by the Kenya Network Cancer Organization, that is the KENCO, which had 70+ civil society and also thousands of patients, cancer patients. Madam Speaker, the prayers of the petitioners, Madam Speaker, looked into the issues that are affecting cancer patients in our country, Madam Speaker. There is a lot of patients who face systematic failure, Madam Speaker, under the SHA fund. Families spend a lot of money in treatment of the cancer patients. It causes a lot